Okay, good evening, everyone. 1 minute to 6 p.m. West African time. All right, it is 6 p.m. West African time. Welcome to Atp Live Monday. Hello, Clara Paul. Thank you for joining us from Instagram. And for those of you who are joining us from Facebook, welcome everyone. I am Gbemisola Boyede and I'm a pediatrician, and I'm here to answer any questions that you may have about the health of your children in the next 60 minutes. So if you have any questions, feel free to start to drop your questions now, and I will try my best to answer them. Before we start, I just want to crave your indulgence to share the link, share the video, and I'm going to do the same. So let's also share the video, make sure everybody can see it and everybody can so nobody will say, oh, I missed it. So let's share the video. I hope you've had a wonderful um evening so far. Happy Easter celebration in advance to those of us who are Christians. So um welcome everyone, welcome. And what I'm going to do now is also share the video and make sure everybody can see me and they can hear me. I just want to pin it first. So if this is your first time, this is ATP Live Monday. ATP Live Monday is brought to you by Ask the Paediatricians Foundation. We are committed to the health and to well-being of all children globally, especially in Nigeria and Sub-Saharan Africa. So we do a lot of things. We have this platform where you can ask any questions that you have about the health of your children. Apart from this live session, which is just 1 hour, you can actually ask your questions on our Facebook group from Mondays to Saturdays, and that one is 24 hours live, 24 hours, 6 days a week. So you're welcome to ask your questions there. So this is just a foretaste of what we normally do on our groups. We also do teachings every Thursday, 10 a.m. We call it ATP Hour, where we kind of take important topics that have to do with the health of our children, and we go into details about those topics. So that is for teaching. And we also do outreaches in the communities, especially communities that are very indigent with very limited access to pediatricians. And we also do outreaches in school. And currently we are doing what we call our ATP First Aid Care project. We are going to the schools, and I'm sure we may have been to a school in near you somewhere, where we teach the children about first aid care, and we also give them reminder booklets, something that they can up with them. So that is what we do on ATP. So welcome everyone. Welcome. We're going to start. What I've been doing now is just making sure I share all the videos, all the links. I just want to make sure everybody can see me and everybody can hear me. So just give me another 1 or 2 minutes and we'll be ready to start. But while I'm doing that, please start to drop your questions. If you're watching on Facebook, on our page, or YouTube or Instagram, just drop your question directly under the video and I will say it. But if you're watching on a link shared, you have to click on the video so that I'll be able to see. Especially for those of us on the Facebook group, you have to click on the video to drop your question so that I can say it. If you just drop it as comments in the group, I may not be able to say it. So make sure you click on the video and your question is directly under the video. And please, as you're asking your question, remember to start with the age of the child. As a pediatrician, we see children from 0 to 18 years. So they are not all the same. And the answers we give depends on the age of the child as well. So it's important for you to tell us the age of the child when asking your question. So thank you so much, everyone. Thank you for those of you joining me on Facebook, on Instagram. I see you all. Happy Monday, everyone, and welcome to ATP Live. I think I've got a question already on Instagram, and so we're just going to start. So let me welcome you once again. Welcome everyone to ATP Live Monday. I am Gbemisola Boyede. I'm a pediatrician, and I'm here to answer any questions that you may have about the health of your children live in the next 1 hour. So, but if you have any question after the live session, or you are watching a recording of this program after the live session is over, feel free to head over to Ask the Pediatrician Facebook group, and you can ask your questions there. Myself and all my colleagues and our moderators will be there to answer your questions as well. So don't feel like, oh, I've missed this 1 hour. We're actually available Monday to Saturdays, 24 hours daily to answer your questions. All right, so let's start with Instagram. Clara Paul, my 1 year, 7-month-old daughter is having a bulge in her private parts. Okay. Each time she cry or try to stress herself. Okay, Clara, what you just described sounds like what we call hernia. Hernia is something that is like a bulge, and depending on which part of the private part, it could be an inguinal hernia, it could be a femoral hernia. It's not quite clear to me which one it is, but what you describe is typical of what we see in children who have hernia. In hernia, there is like a little space somewhere that should not be there, and because of that, when the child coughs or when they cry or when they exert anything that increase the abdominal pressure, it will force some of the content of the abdominal of the abdomen to go into that space, and that is where you will see the bulge. And when you press it, it will go down. So we call it hernia. And depending on which part it is coming from, it can come from the inguinal area. That is the area along uh, the upper parts of the hips, that's what we call the inguinal area. You can also come from the femoral area, also close in that area. You can also actually have umbilical hernia coming from the navel area. You can have different kind of hernia. So what you need to do, Clara, you need to take this child to the hospital, and then our colleagues, usually the pediatric surgeons, they can examine the child for you, and most likely this child will need surgery. It's not a major surgery, it's a surgery anyway, but the child needs surgery to repair the hernia. So we call it aneurysm. So they will return the whatever is coming out through that space, they will return it back to their normal position, and then they will close that space. So kind of close the hole and make it difficult for anything to come out from there. So it's a procedure that the doctors can do for you. So we call it aneurysm. So you really need to go back to the hospital. So Clara, I hope you are still there, and I hope you're listening to the answer to that question. You need to see the surgeons and the pediatric surgeons, general hospitals, teaching hospitals, or even some private hospitals have surgeons, and they will be able to do the procedure, and your child should be fine. So I hope that is okay. All right. Thank you so much, Clara. Let me know whether you get the answer to my question, and just drop a comment. So welcome everyone. Welcome. If you have any question, please drop your questions. Start with the age of the child. Give a short description. Ask your specific questions, and I'll try and answer them. Okay. Thank you, Nurse Nura Zani. Thank you for joining us. And yeah, brave, happy girl. Good evening, doctor. You're welcome. All right, so Yabrifa is asking a question. Please, what quantity of water should I give my 6-month-old baby after feeding or daily? Okay. Usually after 6 months, your child can take water in addition to food. But remember, at 6 months, the child is still supposed to be taking breast milk. And so you keep breastfeeding as you were breastfeeding before. And most of the water, most of the liquid the child would take will be from that breast milk. So the amount of liquid or that a child would take in a day depends on their age. So an average 6-month-old will weigh maybe 7.5 kilos, so maybe about 750 mils of liquid in all. And that includes the breast milk, includes the pap, includes everything the child is taking. So they don't need for you to give them so much water because they're already getting so much of the water from the breast milk. So we would say that for a 6-month-old, you are supposed to give them like 2 meals of complementary feeds in 24 hours. That is how you start complementary feeding in a 6 month old. 2 complementary feeds in a day, the rest should be breast milk. So after each of those solid the complementary feeds, you can give sips of water, and you can give about 10 to 20 mils of water for after the meal. And also, so that is like twice a day. But the child can drink water if they want to, but we don't want a situation where you give them so much water they don't have space for breast milk, they don't have space for other things. So everything is about moderation, and most time children know when they need, they will go for it. So usually after the complementary feeds, you can give 10 to 20 minutes of water and all that. As long as you're breastfeeding that child a lot, that child will still be getting most of the liquid requirement, which is about 750 mils in 24 hours from the breast milk. So I hope that is helpful. If you want more information on complementary feeding, if you go to our Facebook group, we have a whole session on complementary feeds. We have lots of videos that have been made by Global Health Media. Very lovely videos, and they try to show you what to give your child, the quantity, the frequency. Very important. So I recommend that for you. If you just go to our Facebook group, even on our page, our Facebook page that you are right now, if you go to the video section, you will see all those videos on complementary feeds and all this information are addressed there. Thank you, Abigail. All right, let's move on now to Lillian Hasey Moon. Lillian, say good evening, ma. Please, my 5 weeks old baby's stool is greenish. Okay. What could be the cause? So, Lillian, the first question I want to ask is, how are you feeding your baby? That is the most important question we need to know. Okay. So, for your 5 weeks old, should be on breast milk only. So, there are many things that affect or impact on the stools of children. So the food the child is eating, number one, is definitely important. Also, are you giving drugs, or are you also taking drugs yourself that can pass from your breast milk to the baby? So, or are you giving formula? There are some formula that have certain components like iron, and sometimes they can make these stools to be greenish. So these are the questions we need to know. So that was what will determine the answer we gave. So how are you feeding your baby, and what other things are you giving? So for your 5 weeks, so the only thing the only thing we recommend you give your baby is breast milk only, and breast milk on demand. In other words, you breastfeed the baby, as often as the baby wants it. And when you breastfeed the baby, make sure that the baby suck on the not just on the nipple, but the areola, the black part beyond the nipple, and make sure the baby empty one breast, and then you go to the next breast. You must alternate the breast. You must empty the breast. Usually most babies will stop between at least nothing less than 10 to 20 minutes to empty one breast. Actually, at this age, as they get older, they don't need as much time because they can do it faster. But the baby must empty the breast, and you must alternate the breast, and you must breastfeed on demand. So if you're doing that, your baby's stool, for baby on exclusive breastfeeding, the stool tends to be yellowish, like seeded, like all this egusi soup kind of stool. A little bit of water, a little bit of solid, mixed together. That is a normal stool that we expect in babies on exclusive breastfeeding. So that is what we expect. Okay. Lillian said you're on breast milk. You're only on breast milk. Only breast milk, only breast milk. No water, no pap, no agbo, nothing else. Because some of us say we are on breast milk, but you are giving so many other things. We're giving water, we're giving this, we're giving that. So make sure you don't give nothing else apart from breast milk only, including no water, no formula, no drugs, except if the child is sick and the doctor has recommended it. And if you're on breast milk only, make sure your baby is sucking well attached to the breast. Because if your baby is on breast milk only and is having green stool, it's a sign of what we call starvation. It means the child is not getting enough of the breast milk. So you need to make sure you are attaching your baby to the breast and breastfeeding frequently. And usually that means that not less than every 2 to 3 hours, your baby needs to suck, and make sure your baby is emptying your breast and you are alternating the breast. So that's all you need to do. Thank you so much. All right, let's go back to Instagram. I got a question from Ifoma Fiki. My baby had seizure last year. We did MRI. The result was normal. Okay, good. We did EG. The report was termed as generalized seizures. Okay. He has been on drugs, Keppra. Okay. So it, I'm not sure I get the part. Is if the seizure stop or has the seizure stopped? But last week I had I don't know, your question is incomplete if format. So please kindly complete your question so that we know what you're asking about. So if your child is on medication for seizures, the child has to be on that medication for nothing less than 2 years and 2 years of no seizures. Okay. So when children have seizures and you've done an EEG that is abnormal and we started the child on medication, usually we are going to give that medication for a very long time. It's not a medication you take. It's not like malaria drugs. It's not like antibiotics that you give for 3 days or 7 days and you stop. Seizure medications have to be given for a long time. Usually we do it for not less than 2 years. And I'm talking of 2 years of the child not having any seizure. So the child is not having any seizure, but we're still giving the medication. So we count that 2 years from from the period the child does not have any seizures at all. So 2 years going forward, no seizures. That is how long the child is going to take the medication for. And we may need to adjust the dose based on the weight of the child and all that. And as we do that, if the child does not keep having seizures, then we can actually stop the medication, but we don't also suddenly stop the medication. We have to gradually tail it off after 2 years. So it is a long journey, and your doctors have to be monitoring your baby. We always ask you to keep what we call a seizure diary or epilepsy diary so that we monitor that the seizures are well controlled. And after 3 years, no seizure, then we gradually stop the medication. We usually may do that over another 3 to 6 months, and then we can stop. And actually, after we stop, some children will stop having seizures completely, and that's the end. Some children will still keep having seizures, and we still have to put them back on medication. And so I'm not sure which one it is. So if I hope you're still there. If you're there, please uh complete your questions and I will try and answer them. All right, but I'm just giving you a general background so to your question. So I hope you're still there. All right. And I hope you've had the one I said. All right, let's go back to Facebook. Your briefer Abigail. Okay, ma'am, thank you. All right. Your briefer, I can't remember your question again. Okay, you're the one asking about the water. Okay, you're happy with it. Great. Perpetual Hi doc. Hi, Perpetual. Maybe your 5 months cannot sit for up to 5 minutes straight. I'm not expecting your baby of 5 months to be sitting straight at all because 5 to 6 months is when baby begin to sit with support. They're not supposed to sit on their own at 5 months. They're supposed to sit with support. In other words, when we say sit with support, it means that when your baby sits, you stay behind them, or you put a pillow behind them, or you put something to support them. And we don't expect them to do that more than 5 minutes. We don't want to give them back pain because of that. So sitting with support is 5 to 6 months, and sitting without support, which is what I understood by your word, sitting straight on their own, it is a 7 to 8 months whole milestone. So it is important for us to understand what the normal milestones are so that we don't get unnecessarily worried or agitated. So there's nothing wrong with a 5 month old not sitting straight for 5 minutes. I don't expect the baby to be doing that. So if you want to know more about normal milestones, if you go to our website, we have an article. It's my child's development on course. So if you go to that article, you will see all the different milestones and when we want you to be concerned. Like if your child is not able to do this at this age, then see also. But most of the time, we it's just so that you have an idea of what is normal, what is abnormal. And even when we say 5 to 6 months for sitting with support, that is even average. That is like 50% of children. Some children will still not do it at that time, and it's so we still give them a little bit of time to catch up and all that. So we will not be worried at all with a 5-month-old who is not sitting straight. So that is still normal for this age. So if your people want to sit, let them sit with some support. And after, but by the time they're about 7 to 8 months, then that's when people will be able to sit on their own without support. Okay, so I hope that is helpful. Yes, okay, you said the birth weight is 3 kilos. That's okay, and you're happy. Okay, great. Okay, I don't think I have any more questions, so feel free to ask any question. This March is a month where we celebrate lots of cases. We have done the World Oral Health Day. I think that was on the 20th of March. We also have what the World Down Syndrome Day. Down syndrome are children with a chromosomal disorder where they have three of the chromosome 21 instead of two, which majority of people who don't have Down syndrome have. So it's World Down Syndrome Day on the 21st as well. It's also the World Tuberculosis Day. So if you have any question around this day, so unfortunately we were not able to take a teaching on all of them. We just did the one on oral health there, and I hope you have listened to our podcast by Dr. Buki Olatose, our pediatric dentist. So if you have not, please go to Hacks Dr. Gbemi ATP podcast, and you can listen to that teaching on healthy mouth is a healthy body. You can listen, you can learn more about that. So, but if you also have questions around this or around Down syndrome, around tuberculosis, feel free to also ask in the question segment. So we'll be able to answer them. Just to say that if you are here and you have a child with Down syndrome, there are lots of what we call health surveillance. There are things we normally routinely do for children with Down syndrome. We tend to see them every year. So you need to make sure you are seeing your doctors, your pediatrician once a year minimum so that they can check. We check their hearing, we check their eyes, we check their thyroid, we check their heart, we check, we check whether they have what we call obstructive sleep apnea. So we're looking for all the possible challenges these children can have, and we'll try to address them as we see them. So make sure you are taking your children for this regular checkup if you have a child with Down syndrome. And let me quickly say that it's not every child who has special needs or every child who is delayed that is Down syndrome. A lot of people just see a child who has some maybe learning difficulties or intellectual disability, and they just say, oh, it is Down syndrome. I mean, the number of times people have said that it should, we shouldn't be doing that. So please don't accept or take any of such diagnoses from anybody. And also don't label your child by yourself. If your child has any difficulties with their development, you have to see a pediatrician first. We will see the child and then we can tell you there are so many special needs. There are so many of them, different categories like cerebral palsy, global developmental impairment or delay, learning difficulties, intellectual disability. So all of them, they may have some similarities in the way they present, but they are not all the same. So I don't want a situation where we call any child who has special needs Down syndrome child. No, they are not. It's not every special need that is Down syndrome. Down syndrome children have specific way they look, they have specific features, and then more importantly, we can always confirm the diagnosis by doing what we call a karyotype test, where we look at the chromosomes and we count it, and so this is 3 instead of 2. That is simplifying it, and we'll be able to say, okay, yes, that is Down syndrome. So if your child has had that, don't label the child Down syndrome. Say, doctor has seen your child, saying your child looks and have the confirmation test of Down syndrome. Don't call the child a child with Down syndrome. Okay. Ifeoma Fiki, you have come back again with your question, but you've not asked any specific question. Last year, your child had seizure. You did MRI. The result was good. No issues. We had another seizure. The doctor said we should do EEG. We did. The result was generalized seizure. So, what is the question? You've not asked any question. So, just ask the question. I already got the background. Just ask your question now. All right. So, what are the causes of birthmark on babies? Is it a deficiency or something? No, birthmark is birthmark. It means baby is born with it. It doesn't mean there's anything wrong with the child. So we don't really say this is the cause of a birthmark. Babies are born with birthmarks, that's all. But please don't, again, that's another thing I need to clarify, because that last week somebody was asking me a question that the child had some marks on their body which came out when the baby was 7 months, and the person was wondering whether that is a birthmark and blah blah blah. And so please, birthmarks, the baby has to be born with it. So you don't develop birthmark 1 month, 2 months, 3 months, 5 months down the line. That is a skin rash or a skin lesion. It is never a birthmark. So when we as doctors use the word birthmark, we are talking about something the child is born with it, and it's just something on the skin. So sometimes it look like a little bit of redness, sometimes it look like a little bit of um like lines or something. There are different types of them. So most of them look like red color, something, and some of them look like black, like a Mongolian spot on the buttocks. So there are different ways they look, but doctors are trained to recognize this is a birthmark. So it has to be something the child was born with. It has to be something a doctor told you is a birthmark. It's not everything that the baby is born with also that is a birthmark. Okay, so I, for this kind of question, I prefer the parents send me a picture of that mark and tell me the story behind it. This child was born with it. It's not getting bigger. Because it doesn't do anything to the child. Birthmarks don't do anything to children, and usually they will fade away on their own. Some of them may remain permanent, but the most important thing is that it doesn't cause any harm. It doesn't require any investigations, anything. Once we see it, we know it is. So if anything is happening to your child, the child was not born with it, or it's something that the child was born with and it's getting bigger, or something else is happening to it, it's most likely not a birthmark. So make sure you don't make those assumptions. People make a lot of assumptions. And so I always say, when it comes to children, please, let's not make assumptions. Let's always go to our doctors and ask them, and then they will tell you what it is. And then, so if the doctor has seen it's a pediatrician preferably, and they've said it's a birthmark, good. If they've not said that, please don't make assumption that it's a birthmark. Okay, so it's really somebody asking me a question that a child has something that come off at 7 months and now the thing is dry, is itching. That is definitely not a birthmark, but that's what she was calling it. And I'm like, how can this be it can never be a birthmark, because it's something that happened when we were 7 months and it was having different changes, itching, is this, is that, is dry. No, that is not. Birthmark is just a mark used with there. Some people call it beauty mark. It doesn't do any harm. It doesn't cause any. Most of them even fade away on their own. So I think that is what I would say about that. All right, for my daughter of 3 years sometimes have boil or big rashes. It does open like boil. It just disappear, or it does not open. Is that what you want to say? It just disappears, but the spots will end up being dark, like dark scars. Okay, so what you are describing is not a boil. Okay, when we use the word boil, we're using it for a skin infection where there is something like underneath the skin, there's something like pus, yellow pus gathered. Okay, or sometimes it could be red, whitish, but you tend to see it's more like yellow, and they tend to rupture, or and then it will bring out small that pus, white, yellow, whatever, and then that's it, and doesn't leave a stain or a mark on the body. So that is how boils look like. So what you're describing sounds more like what we call uh, um, papular urticaria, which is a form of allergic reaction that the children, when they have it, they will be itchy, and the next thing they will have all these black spots. So that is a form of an allergic skin condition. All right, and that is something some children tend to have a trigger. It can be triggered, for example, by flies, or what they call all these bites, insect bites. Some children even dust or something. So there's a trigger for it. So what we normally say for popular urticaria, some children going through a grassy area, or things like that. So we tend to tell parents, avoid the triggers. When you avoid the triggers, that may be all. You need to wear them long clothes that cover their legs and feet and all that. And sometimes you don't know the trigger, so there's nothing you can do about preventing it. But what you can do is that when it happens, because some of them are tend to be itchy and all that. So there are medications that we can give to reduce the itching. We also encourage you to keep their nails short and all that. But the good news with popular urticaria is an allergic condition, is a sensitivity some people just have in their own body. They tend to outgrow it with time. So as the child gets older, they tend to outgrow it. Parents worry so much about all the stains and the marks on the child's legs. But the good news is that as they get older, also those marks will fade away with time. We don't do anything about it. So that is what your child most likely is having. I've not seen it, but the best thing for you to do is to send us a picture of it. But the way you describe it, it sounds more like popular urticaria. But you can send a picture and then we can confirm that. But usually, like I said, we don't really do much about it. It's about avoiding the triggers. If you can avoid the triggers, when they have a flare, we deal with the flare, and hopefully the child will grow with time. All right. Let me go back to Ifeoma's question, because you keep sending your question. And let me just see whether I can. Okay, so your child has had the EEG, and the EEG result was generalized seizures. Okay, you just keep sending the same information. What is your question, Ifeoma? I've had all the information you said. What is your question? You've not asked any question. So your child had a EEG that was normal, had another EEG that was abnormal. Your child is already on medication. Your child has had 2 seizures. What is your question? So I know what to address, because you have not asked. Stop copying and pasting the same thing. I guess maybe you're having internet connection difficulties, but just ask your question straight away. Don't repeat the same thing you've posted. Just ask your question. If you can hear me, I hope I can, because you just keep saying the result was generalized seizure. What is the question? So I know what to say about it. All right. Yeah, it doesn't open like boys. Okay, I've answered the question. That's okay. Yeah, I guess that's what you're trying to say. Um, yeah, the marks fade. Yeah, it will fade away. It's nothing to worry about. So if you know the things that tend to trigger, you just avoid it. So for those kind of children, we say keep their nails short, wear them long sleeves, especially during evening time, because that is when most of those insect bites happen. Use very natural products on their skin, because some of them can react to their soap, they can react to their cream. So use natural soap, like the black soap, the one without perfume, the real natural black soap. Use things like Vaseline or olive oil or coconut oil for their skin, not any of these fancy sweet smelling stuff, because most of those things are chemicals and the children can react to them as well. So those are the little precautions you can do, and over time most children will outgrow it and it will stop, and then they'll be fine. So there's not so much you can do about it. But if you worry, if you want a second opinion, what you need to do is to see a dermatologist. So there are different kind of doctors. Everybody has their own specialty. So the doctors for skin, anything skin issues, skin disease, skin disorders, the doctors for them, we call them dermatologists. They're usually available in our teaching hospitals and some general hospitals. So they tend to do clinics. They call it skin clinics. So you can go for any of those kind of clinics. They will see it and they will tell you what to do, and then they'll be able to support it. But most of those kind of things, the children will outgrow it with time. All right. Yahweh's pride. How do you stop breastfeeding for toddler? You just stop. There's no special way to stop breastfeeding. Once you think you are ready to stop, you stop. So that is all we do. So it is a toddler. When you say toddler, what's it? So usually we recommend that you breastfeed for up to the age of 2 years. That's what we recommend. I know some of you don't like that, but um at least do as much of breastfeeding as you can. The more you breastfeed, the better for the baby and for you as well, because there are advantages. You know that when you breastfeed for long, your baby is protected against you are protected against breast cancer. So the longer you breastfeed, the better. Ifeoma, I can see you. Please just ask your question. Don't repeat what you've posted. Just ask the question. You've told us about the seizures, you've told about the MRI, you've told us the EEG. What is your question? You've not asked a question, or maybe it's been cut off. I need a question so I know what to say. So that's what I'm waiting. I'm waiting for you. So just say what the question is. All right. Okay, coming back to Yahweh's Pride, your question. So when you're ready to breastfeed, to stop breastfeeding, we say 2 years or beyond, but even if it's 1 year, you're ready to stop. Just make sure your child is eating all the other food. The child is well established on complementary feeds before you start to wean the baby. And we recommend that you wean the baby gradually. In other words, you begin to reduce the breastfeeding gradually. Okay, your baby is 2 years old, so that's fine. You can wean the baby now if you want to, and you reduce the breastfeeding gradually. So you may first decide to stop breastfeeding during the daytime and only breastfeed at night. Okay, and when you're ready to stop the breastfeeding at night, you just stop. Some people feel it's easier for them, maybe for the baby to be with maybe grandparent or somebody, but you just have to make up your mind. I find that most times it's about you being psychologically ready yourself as a mom. So you just stop, and the children will cry 1 or 2 days. Make sure you wear fan bras. You don't succumb to the temptation to resume the breastfeeding. So once you do that, after a couple of days, the child will forget about breastfeeding and you too can stop. If you have pain, you can take painkillers. If the breast is heavy, you can press a little bit out or use a warm towel, we'll call it warm compress, just to make you help you feel better. But once the baby is not sucking the breast within 2 3 days, your breast is going to dry up, and that's it. So that's how to stop. If you want more tips on Winnie, we have an article on our website called Simple Tips for Winnie on www.askthepediatricians.com. You can check out that article. It has a lot of other tips, but that is just a summary I've given you. All right. Igwe Adaora. Chidima, good evening, Doc. My son is 5, was diagnosed with dyslexia and dysgraphia. They recommended speech therapy. Mm-hmm. Okay, I have a lot of issues with that diagnosis itself. Okay, so I will tell you what each of those diagnoses means and why I have issues with what you've said. Number one, dyslexia is a disorder, it's a learning disability that has to do with reading. It means the child cannot read. So that is dyslexia. Dysgraphia has to do with writing. It's a learning disability of writing. It means the child struggles with writing. So if a child is struggling with reading and writing, why is this a speech therapy they're recommending? All right. So what I'm going to recommend for you is that you need to see a developmental pediatrician. So we live in a country where everybody does anything they like and not everybody knows what they are doing. Okay. So a lot of people that are going around claiming to be able to do special needs, this and that, doing assessment and giving all this kind of recommendation or diagnosis, they are not professionals. They are not trained to do some of these things they are doing. Okay, so it's best to see a real professional. So your child needs to see a developmental pediatrician or a psychologist, clinical psychologist, if you don't have it. These are the people that are really trained, not the people that will say they are doing dyslexia testing. They will ask your child to do this, that, and they will quickly make a diagnosis that doesn't make any meaningful sense. So please see your see a developmental pediatrician. That's the right person to do an assessment for your 5-year-old when it comes to that. Okay. I want to know whether you will ever write or improve their intelligence. I cannot answer that question because this diagnosis is not, and the recommendation, they are not sitting together at all. They are not making any much sense. I would rather you tell me what are your concerns with your child, and like what can your child do, what can your child not do. I know at a 5-year-old level, and I will tell you what I think may be going on with that child. So, and after that, we'll be able to say, but this child needs to have a proper assessment first, and then that's when we will know what to do. But the way the diagnosis is written and the recommendation made, it doesn't make, it's not sitting together. So I have a feeling that this is done by somebody who does not know what they are doing. So the right person to make a diagnosis, the therapists don't make diagnosis, therapists can do support for children. So if a child is not talking, you say speech therapy. If a child is having difficulty with writing or doing self-help skills or play, you see an occupational therapist. If a child is struggling with their walking, running, doing motor skills, you see a physiotherapy. The therapists are not the one to make diagnosis for children with special needs. That is the job of a developmental pediatrician. Okay, so if a therapist sees the child, they should recommend you see the pediatrician, because the pediatrician, when they see the child, we're looking at the entire child, everything about the child, including why the child is having difficulties with doing those things. So I know there are not many of us in Nigeria, so that is a challenge, and a lot of people have to come in, and unfortunately is some of them just swindle parents of their money and really don't do much. So but at least it's better to see a pediatrician, preferably a developmental pediatrician, and then they will tell you where to go from that. All right. Okay, Farmer Fiki, what can my baby take so the seizure will stop forever? Okay, if your child is having seizures, your child needs to be on anti-seizure medication. That is Keppra, okay? That is an example of anti-seizure medication. And I don't know whether you heard me, because it seemed like you went off and you came back. If your child is on medication for seizures, the child is going to take that medication for 2 years minimum of no seizure. In other words, if your child even have 2 seizures and we start medication and the child does not have seizures again, the child will still need to keep taking that medication for the next 2 years minimum. Okay. Every time your child has seizure, that is the end of that. We start again. From when the child does not have seizures for 2 years, that is how long the child is going to take the medication. So some children were able to quickly stop the seizures and they will take the medication for 2 years non-stop. You don't stop it, you don't forget it. Even if the child is sick, even if the child is fasting, the child must still take that medication. So the child has to be on medication for 2 years straight ahead. After 2 years of no seizures, with the child taking their medication regularly, then we can begin to stop the medication. Okay. And we don't suddenly stop seizure medication, we're going to stop it gradually. We can do it again another 3 to 6 months, gradually till it's off. So your child has to be under a pediatrician or preferably a pediatric neurologist who will be monitoring the seizures. We will tell you to have what we call a seizure diary or epilepsy diary. Anytime the child has seizures, you have to always write it down. So it is very important for you to understand what is going on with epilepsy. Okay, it is not one of those conditions that you can just quickly just do one thing and that is the end. No, it's a it's a long-term treatment, and you have to make sure your child takes medication and you don't stop it suddenly. You don't forget. If you're giving it 8 o'clock in the morning, 8 o'clock at night, you have to keep to the same time. You don't just give it when the spirit moves you. You have to be consistent. If not, the child will have more seizures and it's not good for the brain. Okay. So that is that. There is no supplements to stop seizures. All right. Your child will need to take the anti-seizure medication. I don't understand what you mean by your child being stronger. Maybe you need to tell me what you meant by your to make your child stronger. Is it because the only thing you've told us about your child is that your child was having epilepsy? You never mentioned anything about being strong or not strong, and I'm not really sure what that means. So you really need to tell us what you mean by your child being stronger. Is your child also having developmental delay? Are there things the child is not able to do? And what is the weight of the child? So you may need to explain that more. So the only thing I've been able to answer, Ifama, is about the seizures. So your child needs to be on the seizure medication for now, and your child needs to take that medication at least 2 years of to the last time the child has seizures. Okay, so the child has to take the drugs for 2 years with no seizures at all before we can begin to stop the medication. And that child has to be under the care of a pediatrician. Usually, we will be seeing your child maybe every 3 months or so. We have to see that child regularly. Unfortunately, some parents will tend to run away when we say, after you think the child is no longer having seizures and you think, oh, I can just stop the drugs. No, please. So during the epilepsy week, I did a lot of teaching on epilepsy, and I did a lot of answering of this kind of question on epilepsy when we did the epilepsy day, World Epilepsy Day. So please, if you go to our Facebook to this Facebook page, or if you go even into our Instagram TV channel, or you go on my podcast, Ask Dr. Gbemi ATP podcast, on our YouTube channel, ATP TV, you can watch all those videos on epilepsy. You really need to watch them. There are about 3 of them. So watch all of them. Even some of them have answered all these questions. Very, very important. And if the child has other health issues apart from the epilepsy, we also need to address that. So you may need to clarify what you mean by your child being stronger, because I'm not really sure what that question is about. But when it comes to neurological problem, it's not a supplementing. It is about making sure we're addressing whatever is wrong. But you say you already done an MRI that was normal, so that's a good thing. So if the MRI is normal, though you just said it's good, good is not the same thing as normal. So you have to say, is there any abnormality on the MRI? So MRI is either normal or abnormal, not good. So, but if that's what you meant, then that's okay. If you meant normal is what you meant by good, that's fine. So the most important thing is were your doctors able to tell you why your child was having seizures, and whether they have an explanation, because that's also will help us to know what to tell you in terms of what to expect. So if a child already has a brain injury, or a damage in the brain, or an abnormality in the brain, they tend to have epilepsy for longer. And sometimes for those children, we don't even stop the medication ever. They are going to take it for life, because we know there's already an underlying damage in the brain. So we know the epilepsy will always happen if we try to stop the drugs. So for those kind of children, we don't even stop the drugs. But if the brain is normal, EEG is fine, then those are the kind of epilepsy we call idiopathic epilepsy, that we don't have an explanation. And the good news is that those kind of epilepsy, sometimes we're able to get away when we stop the medication gradually after 2 years. Most of them will stop having epilepsy, so they'll be completely cured. So there are possibilities for that. But so we really need to have all the background. But I'm happy you already seen your doctor, so you can also ask them these questions when you go for your follow-up reviews with them. All right. So if you let me know whether you got my answers, so because I wasn't too sure whether you're still there. If you're there, just let me know that you've understood, and then I can I'm sure you got the answers. Okay, Igwe, so you've seen a developmental pediatrician and neurologist in Luth in UPTH. Okay, good. They recommended speech therapy because his speech is not clear. Okay. So if you, I'll come back to you, Igwe. So if your child is having speech that are not clear, that child does not have a diagnosis of dyslexia, that child does not have a diagnosis of dyspraxia. There's more going on with that child. So I will tell you that that diagnosis is wrong, because there are more. So when we say a child has dyslexia, it's not about the speech, it's about reading. When we say a child has dysgraphia, it's about writing. So, but also, and those diagnoses tend to stand alone. So we tend to use the word dyslexia for a child who does not have any other issues beyond the reading. And we tend to use the dysgraphia for a child who does not have any other issue beyond the writing. But if a child is having issues with writing, with reading, with speech, that child is having already 3 different aspects of the development affected. The diagnosis is not going to be dyslexia or dysgraphia again. We need to look for a diagnosis that will tie together everything, which is why I told you right from the beginning that diagnosis is wrong. All right. So I will stop there. Okay. All right. Okay. I'm happy you've understood my question. You say, okay, sometimes you work some. How old is your child? You didn't tell me the age of your child. You only started with my baby. My baby always starts with the age of the child. So if you start with the age of the child, I will know whether walking and falling is age appropriate or not. So start with the age of the child, because that's very important. So that I will start with Igwe at that point, but I will recommend that your child should have a proper assessment with a trained pediatrician, a neurodevelopmental pediatrician. Okay, Hatinuke Dairo, what is the best vitamin for stronger bones for a baby less than 1 month, 1 year? I guess I hope it's 1 year. Always write the age in complete sentence. Okay, don't just say 1. 1 doesn't mean anything much to a pediatrician. I can have a 1 week old, I can have a 1 month old, I can have a 1 year old, I can have a 1 hour old baby. So I need to know what your 1 stands for. But when it comes to what stronger bones, It's not a vitamin issue at all. Then what do you mean by stronger bones? Because I always want to get behind what you're thinking. What do you mean by stronger bones? Why do you think your child's bones are not strong? Because sometimes parents, when their children are floppy, they think it's about the bone. It's not the bone, it's in the brain. Or when a child is not walking well and all that, it's not the bone, it's the brain. So I always want to know what you mean by stronger bone. How did you know that this child's bone is not strong? That is number one. But even if I take your word at face value and I agree with you that the problem is bone, then the issue with bone is calcium, not vitamin per se. So, and calcium is about milk. So for your child who is less than 1 year old, that child should be sucking breast milk. So that child should be on breast milk. And if you're not breastfeeding, then you must be giving age appropriate formula or milk. That most children get their calcium from milk. Okay. Most of the other vitamins they get it from food. Vitamin D, which is also important for bone and all those, is from the sun. So luckily for those of us in Nigeria, we have lots of abundant sunlight. So as long as a child is playing and not cook up in the room, they will get their vitamin D. And okay, so and most of this milk, they also have all those vitamins part of it as well. So, but you need to clarify what you really meant by stronger bones so that we are actually on the same page. All right. Yeah, brief. My baby of 5 month pull like kata. What is actually the cause? Well, how are you feeding your 5 month old baby? So I always want to know what you're feeding your baby. Whenever you ask question about stool, the first thing we need to know is how that baby is being fed, because stool is a reflection of what goes into the mouth of the baby. So mucus in the stool can be from the drugs, from whatever you're giving the child. So for a 5 month old baby, your baby should be on breast milk only. Breast milk only for the first 6 months of life, and then you can now start to give other food while you keep breastfeeding from 6 months. So if a baby has this kind of thing, we want to know, how are you feeding that baby? Or is there any other thing that's going on with that baby? Or is there even blood in the stool? Because that can also be a sign. So without knowing that information, we won't be able to say this is how or this is the cause of it. Okay, at 5 is not writing or reading. I was told they do not have occupational therapists in the hospital, and since it's not violent, behavioral therapy was ruled out. All right, please help me worry about Igwe Adora. Okay, I will tell you one thing: your child needs to have another assessment altogether. Okay, your child needs to have an assessment. I do not agree with the assessment your child already had in UPTH. I don't think whoever you saw, I'm not sure they really know what is going on with your child. So that is number one. So, and you are not telling me what your child is not able to do. I am not interested in the reading and writing at 5, to be honest. That's not my main concern. My main concern is your child's speech. Can your child talk? Can your child have a conversation? Is your child able to play with other children? Is your child having any repetitive behavior? All those other issues, those are the concern. Because most children at 5, they are just starting primary school. I mean, nobody is going to be worried about a 5-year-old who is not reading as such. I don't. So that's why this diagnosis of the excessive dysgraphia, we tend to reserve for school age children, my child about 6 and above. But if your child is having speech issues and all those other issues with development, that is not dysgraphia, that is not dyslexia. Okay, so we're going to be looking at something like, is it global developmental delay? Is there part of it that could be autism? Those are the kind of diagnoses that we'll be thinking of in a child who has multiple issues, who is having difficulty with fine motor skills, who is having difficulty with language skills, who is having, reading plus or minus, it's not a major deal at the 5-year-old level. So those are the kind of things, that I'm thinking of. Uh so for me, it's better you say what you are worried about as a mom. What has the teachers told you at school? What is it that your child, when you compare to other children his age, that they are doing that your child is not able to do, that is of concern to you? That's what I will be worried about, and that's what will determine the diagnosis the child has. So we in developmental pediatrics, we don't just label everything. Oh, the child is not writing dysgraphia, the child is not reading dyslexia, the child is not speaking. So no, we look for something that puts everything together as one, something that will explain everything. So which is what I think your child should have had. But what they are telling you is just a sign of how will I put it? So it's a sign that somebody is not really understanding what is going on with the child, and they're just picking each of them one by one instead of tying it together as one and giving. And the most important thing is that if the child doesn't have the right diagnosis, the child is not going to have the right support. That is the most important thing. So that's where I will stop at that level. All right. Justina, thanks for all you do. Please, do children inherit eating habits from parents? Well, I don't know about eating habits being something you inherit, but your child can copy. And habit is something people copy, not something they inherit. They don't inherit it as a genetic thing. It's something they copy. They see you do it, then they copy you. So that is possible. So my son of 13 months hardly eats more. Jones eats this country, doesn't want more. It depends on what quantity the child eats in, what is the weight of the child. So that's what we're worried about. Is the child eating enough to have a good weight? What is the weight? If the child is having good weight and we're not worried, then nobody's going to worry. But if the child is not, if the weight is small for their age, then that's when we worry about malnutrition. And then that's when we want to do more about it. And we have to find a way around it. All right. Okay. Oh, okay. If I'm not thinking, so your baby is 4 years old. If your 4 year old is always falling, he walks and falls down, his steps are not stable, then there's more going on with the baby. A 4 year old should be walking, I mean, should not be falling at all. So I don't know whether the falling it may be related to the epilepsy. It may be related to what is going on in the brain. It may not be related. Or the falling may actually be a seizure itself because some children who have epilepsy, they fall. And that is a seizure. It's not because they are having problem with walking, but when they're having epilepsy, they are going to fall. So it's not clear, but you can clarify that from your doctors. But your 4 year old should be walking normally and should not be falling a lot. So if the 4 year old is falling a lot, and is also having epilepsy, then definitely there may be more going on in the brain of that child. Unless the fall itself is a form of a seizure and not like clumsiness, which is what I thought we were talking about. Okay, so I think you should just, when you see your doctors, ask them what they think is causing the epilepsy and the falls. Okay, I guess that's why they did the MRI, which was fine, but they should be able to tell you whether they can figure out the underlying issues there. All right. Atinuke Dairo, 1 year old. Okay, yeah, I suspect you already talked about 1 year old. What was the question again? Vitamins. Okay, what? Oh, no, with no vitamin. Let the child just eat well. But if you're talking of bones, then it's calcium, and that is breast milk. Good evening. Please, I sent a message, but no response. We don't take messages on ATP. If you have a question for us, please post it directly to our Facebook group. And our Facebook group, it may take up to 40 to 72 hours to respond to your questions because obviously we have to do other work. We have to see patients in the clinics and all that. So, but usually we will respond to your questions. Most of the time we do it within 24 hours, but at most 48 hours. But we don't do question and answers in our inbox. So you will never see us answer question in inbox. So always post your question directly to our Facebook group. And if you want private one-on-one kind of answers, then you have to go to our ATP clinics and send us a WhatsApp message, and then we'll be able to respond to you. But that is not a free service because that is consultation with our professionals. Okay. Shamsi, too nice. Please, is my question being deliberately ignored? I can't see your question, Shamsi, or I must have answered it then. Let me see whether there's a Shamsi question. Mm. Okay, Shamsi, I didn't see your question. You didn't post any question here. I've looked through all the questions. The very first question on this platform was by Clara Paul, and I've answered a question. I can't see any question from your hand. I've looked through all the questions. So you may have thought your question dropped, but it didn't drop. So the first question I'm seeing from you is you saying, is your question being ignored? But the truth is you've not actually posted any question. Yeah, there's no question here from you. Chomsy, too nice. So post your question again. You didn't post a question. It may have not come through to our hand. Maybe it's a network. Sometime network. I'm actually because luckily I can still see the very first question that was coming here. The very first question is by Clara Paul, and that's the very first question I answered today. And I can't see anyone from you. I can see a lot of informers repeated questions. So Chomsy 290, please ask your question again. It is not showing on my screen. Thank you. All right. Let's go on. Uh, Ire, I don't know how to pronounce your name, but you said that my baby is 10 months old and we have been treating anemia since it was less than 2 months old. Is this normal? What kind of anemia is your baby having? It's not preterm and no jaundice. My doctor is just prescribing blood tonic. That is the problem. So your doctor should not just be prescribing blood tonic. Your doctor should be able to say what kind of anemia. Is it iron that is low? What is causing anemia in a 2 months old baby? So that's the first question you want to ask your doctor. So your baby didn't have jaundice, didn't have, it's not preterm, and your baby just having anemia. So what is your doctor prescribing? Iron supplements. So is it iron deficiency anemia? So please see a pediatrician. Are you seeing a pediatrician or just any doctor? Okay, so when we say anemia, for those who may be wondering what we're talking about, anemia means shortage of blood or low blood level. But there are different kind of anemia, and there are different causes of anemia. So we really need to know the type of anemia that your baby is having. So I did a presentation. I think if you go to our podcast or YouTube channel, you'll see that presentation. I think I did on anemia. I think that was this year, maybe in January. So you may want to listen to that. No, there's no reason, there's no way your doctor can treat your child's anemia when there's no diagnosis. Okay, that is actually wrong. Okay, for example, there are anemias that we treat with blood tonic, like iron supplements. There are anemia that are due to folic acid deficiency, so we give folic acid. There are anemia that are due to bone marrow suppression, so we give an hormone, erythropoietin, and not iron. Some children who even have sickle cell anemia, we don't give them blood tonic, we give them folic acid, and sometimes we just we understand that this is uh, sickle cell anemia and all that. There are anemias due to different things, so your doctor cannot just be giving you medication. That's why it won't be improving, because what if you are not actually addressing what is causing the anemia? And a 2 month old, very unusual for a 2 month old to have anemia. So if you're 2 months old has anemia, we really need to know why. Okay, did you have any problem during your delivery? Is it that you have twins and one twin had more blood and the other twin didn't have blood? Or did you lose a lot of blood when the baby was being delivered? It's very unusual for a 2 month old to have anemia. And if a 2 month old had anemia, we need to know why. So we can't just be giving that baby blood tonic without knowing why. So I think you really need to see a pediatrician. All right, Chomsy, you've asked a question. Last week you said it was big. Should I be concerned? Chomsy, I can't see the beginning part of your question, no. So you have to ask. The last part is what I'm saying. You say your baby is big. So what is the weight of your baby? Can you take the question again? Chomsy 296, please, can you ask your question right from the beginning? It's not, I think you are some part of your question either you think is dropping here, but it's not dropping. So you may need to make sure you put all of them in one comment so we can see everything. Okay, your baby has also taken erythropoietin. So Ire Peter Diana, sorry if I didn't pronounce your name well. Which doctor are you seeing? Are you seeing a pediatrician? Where are you seeing the one in a teaching hospital? And then you need to ask what the cause of your baby's anemia is. You may actually be referred to who we call the hematologist. So there are doctors that are specialists in anemia, anything that has to do with the bone, with the blood and all that, hematologists. So your child has to see one of them, pediatric hematologists, usually in a teaching hospital, so that they can figure out why your child's blood is low. So yeah, so they are really worried if you are giving you erythropoietin, giving you blood tonic, there is more going on with your baby, and they really need to know. They will know. They will know what is causing it. Maybe you don't understand, or maybe they didn't break it down for you. But it's very unusual for your doctors to be treating anemia without knowing what they are treating. So, and the fact that they are giving you erythropoietin and giving you blood tonic tells me there is more going on with the baby. So feel free to ask more questions. All these questions really you should ask your doctors because they are the one that should be able to answer you. And if you are not happy with the answers they're giving you, please ask for a referral to a teaching hospital to see a pediatric hematologist. So that's the right person to see. And they can answer your questions and all that. No, I think you should go to a teaching hospital. That's the right person to do. Okay, Chomsy, what is your question? Your baby is 11 weeks old and the weight is 6.3. So is it too big? Is that the question? What did I say last week? Okay, so what I said last week is that your baby was born, any baby born more than 4 kilos, we say is big baby or macrosomic baby. Sometimes some babies are just big because they are big in their families, but sometimes some babies are big because it is a sign of other medical conditions. There are medical conditions that can make a baby very big. So what I was saying is that it's just important that the doctors check your baby and make sure there is none of those medical conditions that make your baby to be very big. 4.6 is very big. So that's what I meant about that. So and your baby is 6.3 at 11 weeks. It's not so bad. That is because that means your baby has only gained about is it up to 2? It's even up to 2 kilos. So maybe has not gained more than 2 kilos since birth. That's about 1.8 in 11 weeks, which normally would have even been slow because we expect your baby to gain about 900 grams every month. So your baby is almost 3 months and it's only gained about less than 2 kilos. That would have been slow. But because your baby started so big, so it's possible your baby is now kind of leveling up, And so 6.3 for 11 weeks old is not bad weight. So I'm not worried about that. So it means baby's weight is not increasing too much, which is a good sign. Okay. So, but the question is to make sure that your baby is not having any medical condition. So if that's what it's just a routine check to make sure that there's no problem. So if you're seeing a doctor and they say your baby is fine, they couldn't figure out any other medical issues, then there's no reason for you to worry. Chomsy, just keep breastfeeding your baby and you'll be fine. So I hope you're happy. I hope I've answered your questions now. If not, just let me know. Okay, he says okay. Good. Thank you. All right. Justina, let me just answer the one on Instagram, Facebook. My time is up. Gotta go home. Justina, I say your baby's weight at 1 year is 9 kilos. Okay, so that's the baby you are asking. It's not eating much. Is that? That's okay. The weight is fine. I'm not worried. Usually we expect your baby to be about 10 kilos at 1 year, so it's not so bad. 9 kilos is still okay, but it was the Facebook graduate. Okay, you sent us a post on your Facebook. We will answer your question. Give us some time. You must have just posted it today, so give us at least 24 to 48 hours. So we'll answer your question, Queenets. Don't worry. Sonia, so the way we answer questions is not how they come. Okay, so questions are answered based on the kind of question. So there are simple questions that even some of you can answer. So our moderators will answer that. But if there are questions that are very serious and technical, it's our pediatricians that we have to answer. And that may take time because obviously, pediatrician will go to work in the morning and now I'm here doing ATP Live. So I've not even gone to the Facebook group to answer any questions today, but we will definitely answer it in another 24 to 48 hours. We get answer, which is why we say if your question is very urgent, like you really need to see us in the hospital, then you have to come to see us in the hospital. If it is ATP is not for urgent, very serious questions, those kind of cases, you have to come and meet us at the hospital, then we can answer it there. All right. So, but if it's something that can wait, yes, you are welcome to wait. All right. Sonia say, is it normal for a 2-year-old not to say mama? Is the child saying any other words? Or the child is not talking at all? Because if the child is saying other words and not just saying mama, then maybe I won't worry. But if the child is not saying any words at all, then definitely I'll be worried. Okay, it's not normal for a 2-year-old not to be talking. There's not that doctor is not telling you the rules that it could be because it's not his only child. No, that's not correct. That answer is completely not correct. A 2-year-old should be able to say 2 words together. So you say it was counting 1 to 4, but later stop. So regression of speech. In other words, if a child is able to say something before and stop doing them it's a red flag. It's a very big red flag. So if your 2-year-old is not talking, your 2-year-old has a speech regression, I am definitely worried about that child. It's not because the child is an only child. This child is showing signs of autism. Those are the red flags for autism spectrum disorder. You need to see a developmental pediatrician. You will also need to see a speech therapist. Your child needs to have an assessment. Your child needs to have therapies. And you can also go do a screening for autism on Autism Speaks. They have what we call a screening, MCHATs. If you just Google MCHATs screening online, you can do that. It will ask you about 20 questions. And based on the answers you give them, there's no like this is the right or wrong. Just tell us what exactly your child is doing or not doing. That is the way to answer those screening questions. And immediately they will give you a feedback and tell you, based on this answer you've given them, your child needs to see a developmental pediatrician, or your child is fine or not. So you can do that as well. But based on what you've told me today, here I'm worried about your child. This child needs to see a developmental pediatrician. This is not a DHA issue. This is not DHA at all. It's not a supplement issue. This child needs to have an assessment. This child needs to have therapies. And there's what we call early intervention. The earlier, the better. Okay, so that is my own free advice for you. All right. Thank you so much, everyone. Thank you so much for those of you who are watching. I hope I didn't miss out anybody's question. Thank you for being patient with me, Chomsy, and the rest of you. Thank you so much. So if you have any questions beyond our live session, that is okay. Please go to ATP Ask the Pediatrician Facebook group. You can't miss our group on Facebook. Unfortunately, for those on Instagram, we can't do DM kind of answers, and we don't have the capacity to answer every comment that people post on our put under our posts. So the best way to get answers to your questions is by going to our Facebook group, Ask the Pediatricians, and then you can post your questions. Please be patient with us. Give us some time to answer your questions, because we have different categories of people who can answer questions. We have our moderators, we also have our pediatricians and doctors. So if your question is very technical, very complex, we need a pediatrician to answer that. It may take you a bit longer, 48 hours. But if it's straightforward, should I breastfeed for 6 months? What should I give my baby? Those kind of everyday questions, our moderators are able to do that for you. So please feel free to go to post your question. We are there 24 hours, Mondays to Saturdays. We are not able to answer questions on on Sundays. So please, and unfortunately, next week is going to be Easter Monday. So I won't be here. I will be somewhere having vacation, Easter break. So there will be no ATP Live next week, Monday. But we're going to have ATP Hour on Thursday, and we'll be looking at very important topic from one of our doctors. So watch out for that. Thank you so much for joining me. And if you want to rewatch this video or even all the past videos, they are all available free on Facebook, on IGTV, on YouTube, on my podcast. You can always watch all our past videos. And if you have any question, if you are watching a recording and you have questions, please don't post it as comments on the recording, because we will not be there live. But you can always go again to our Facebook group and post your questions there, and we'll be able to answer it. So thank you so much for joining me today. Have a wonderful evening. Have a wonderful Easter, because I won't see you until after the Easter. Yeah, most likely. So have a wonderful Easter, everyone, and God bless you. Good evening, and it's bye.